This is another installation of our LDAT Toolkit webinar series. I'd like to start by acknowledging that I'm delivering this from the traditional lands of the Wurundjeri people of the Kulin Nation, and to pay my respects to their elders past, present, and emerging, as well as the elders of any other communities that might be joining us today. I'm going to run through this in about 20 minutes, and there is a 30-second delay from when I'm speaking to me traveling out through the internet and reaching everyone else's computers. But if you have questions at any time, I've got my colleague Shayla here with me. So just type them into the Q&A box. She'll collect all of the questions and then she'll ask them at an appropriate interval. So feel free to do that at any time. So our topic is alcohol and pregnancy. The toolkit that this refers to can be found on the Community Hub portion of the ADF website, just under the drop-down menu that says Plan. And that's where all of the toolkits and then the recording of this webinar that's being made will also sit in there. So this is the basic toolkit structure. It goes over four different sections. I'm going to primarily be focusing on the overview and the planning because those are the most similar for anyone who's working in this space. As soon as you start getting into delivering and measuring success, it does become quite specific to your program. We'll still run over those, but we're mostly going to focus on overview and planning today. I did just want to open with a little bit of context about alcohol and pregnancy. We've titled it Alcohol and Pregnancy instead of FASD because fetal alcohol spectrum disorder is only one of the potential outcomes of drinking during pregnancy. It's also linked to miscarriage, to premature birth, and to low birth weights. But FASD is also a potential outcome. I know it's called a spectrum disorder because it's different for everyone who experiences it. And that could cover things like a learning disability, specific physiological characteristics, behavioral issues that might emerge as the child grows. There's a range of potential expressions or symptoms, and it is different for everybody. So that can make it quite difficult to diagnose and then also to manage as that person grows up. It's also important to recognize that FASD right now is not recognized as a disability in Australia. It's considered an acquired brain injury. So if you are a person living with FASD, you are not entitled to disability support. This is obviously a problem for the people who are experiencing it. And it also leads to difficulties with diagnosing it. Some doctors might not want to diagnose someone with FASD because of the really heavy stigma that tends to surround those families. We also don't have good prevalence numbers of how many people in Australia are living with FASD. For exactly those reasons, it can be difficult to diagnose. Sometimes the symptoms might be very subtle. And because it's so heavily stigmatized, a lot of women who have drank during pregnancy don't want to talk about it because of the stigma associated with that behavior. And that's something that we really need to keep in mind when we're discussing this as a topic, is the stigmatization of those women, and that mothers are still just people like the rest of us, and anything that was causing them to drink and potentially to drink heavily before the pregnancy, not only has that not gone away, but it might have intensified. I mean, it's beyond the scope of this toolkit, but we do know that in some cases, domestic violence can intensify or can even start when a woman falls pregnant. So it's just, this is going to keep coming up through the toolkit, that we have all of these reasons that might cause a woman to drink during pregnancy, and we need to keep those in mind as part of our effort to destigmatize this as a topic. So the first section of the toolkit structure is the overview, and I'm just gonna jump into it and go through those points one by one. So when we talk about taking action on alcohol and pregnancy, what we're talking about really is providing information, education, and training and support to reduce drinking both before and during pregnancy. And also, again, respecting that it doesn't happen in a vacuum, that there is a culture of drinking and a culture of drinking while socializing that surrounds pregnant women as well. And that leads into our discussion of the target audience. You know, certainly being reproductive age men and women and couples who are involved in family planning, but also extending broader than that to her family, to her friends, you know, to the whole community, really, in terms of raising awareness about the importance of supporting women to not drink through their pregnancy. So some of the main issues that I want to focus on, again, that we need to keep in mind when we're looking at this topic, is that no one is hurting their baby on purpose. I mean, I put an asterisk there because, yeah, maybe you might have a couple of really extreme circumstances, but that's certainly not the norm. Women are not drinking through pregnancy with the intent of hurting their child. Part of the issue here too is the mixed messages that people get about safety. Is it safe to drink during pregnancy? How much? During what trimester? I know I personally have heard a whole range of advice, and getting those mixed messages can be hard for someone to filter through, especially when as a pregnant woman, you're already being bombarded with eat this, don't eat that, you have to behave like this. So adding some confusion about the safety or not of alcohol in pregnancy on top of that can be overwhelming. So that's why we always come back to that not drinking is the safest option, because we don't know how much alcohol at what stage during the pregnancy leads to what negative health outcomes. We can't research it because it would be deeply unethical. So we really fall back on that line that not drinking is the safest option because we don't know how much at what stage is going to do some real damage. We also know that about half of pregnancies in Australia are unplanned. So that can cause some women to drink very early on in their pregnancy because they don't realize they're pregnant. And again, the stigma is a main issue that we have to keep in mind, the fact that it's not considered to be a disability. Now we know that about 1 in 4 women drink in Australia while they're pregnant, and 3/4 of those pregnant women who are drinking tend to be drinking at home and with their partner initiating the drinking about 40% of the time, just to bring it back to the importance of the target audience not just being women, but especially their partners and their family and friends as well. And we know that Australian women are less likely to drink alcohol during pregnancy if their partner also abstains. So in terms of how it helps, again, strengthening the skills, the capacity, and the confidence, making sure that people have the right knowledge, trying to break down some of that mixed messaging, and it'll help to prevent, the miscarriage and the low birth weights, and obviously fetal alcohol spectrum disorder. And in terms of effectiveness, even small changes can make a big difference. So if you have someone who's drinking really heavily or very frequently through their pregnancy, even if you just reduce some of that, that can have a positive impact on the health outcomes for the child. And what we're really talking about is a long-term cultural shift for us to better support pregnant women, to make sure that they still have opportunities to engage socially, to feel connected to their friends and family, not to be isolated by the fact that they aren't drinking, but creating situations where they're still socially engaged and it's supportive. And that could be alcohol-free events, or making sure that your only socializing isn't out at a bar, just making sure that those women don't find themselves quite socially excluded. And in the planning section, which again I'm just going to keep jumping into, the first step in planning is we really recommend linking in with existing programs. There's fantastic work that's being done in Australia on exactly this topic, and that's fantastic for LDATs because it means that you can spend your resources on looking at what are the gaps in your community, how can you best facilitate getting these pre-existing resources out there instead of having to spend the time to create your own. So I'm just going to run through a couple of them. The Pregnant Pause is really focused on partners, friends, and family. And that's all about getting people to take a pledge not to drink, not necessarily for the whole pregnancy. It could be for 3 months, it could be for the whole term, it could even be just while they're around the woman who's pregnant not to drink. And it's creating that supportive culture so she doesn't feel isolated, she doesn't feel like she's socially suffering, and recognizing that, pregnancy is a difficult time and women need the people who love them to be there and to be supportive around her. Your Fertility is a fantastic site that covers all kinds of different fertility issues, but also talks about alcohol. I watched a funny video the other day that was like a drunk sperm and a drunk egg trying to get together, and it wasn't just about pointing out the negative impacts that alcohol can have on your fertility, but also making sure that you discuss about the impacts of alcohol on paternal fertility as well, instead of, again, making it just about women. So Your Fertility is another good resource. And then Women Want to Know is not geared so much at the community, but more so at healthcare practitioners. And this was developed because they found that a number of women weren't being asked by their healthcare provider if they were drinking during their pregnancy or how much they were drinking, and they weren't being provided with really clear advice and direction around how to manage alcohol in pregnancy and the risks associated with it. So the Women Want to Know program is aimed at educating and upskilling healthcare providers on the importance of providing really clear information to women who are pregnant or if they're hoping to become pregnant, and very clear direction around not drinking in pregnancy being the safest option. There's another couple of organizations as well. No FASD Australia, I would really consider to be the peak body. They've got fantastic resources. If you were looking, for example, to run an event on No Faz Day, they always have a hashtag, so that'll be a Twitter and an Instagram hashtag, where people from around the country and around the world actually will post to that hashtag the events that they're holding. On No Faz Day, it's fairly popular to have a breakfast event followed by a relevant speaker. And the FASD Hub Australia is another site that has a phenomenal collection of all kinds of different resources, videos, fact sheets, flyers. It's really, when you're developing your program, it's really worth having a look at what they've got on offer because they've got lots of fantastic stuff that's already created. We also cover off in the toolkit some critical considerations. So that's things like engaging the whole community, including men, and making sure that we emphasize that it's not just a women's issue. So I'm going to touch on some of those just because I think they're so important when we're running these programs, that they don't blame or stigmatize women, that they're respectful and incorporate the local community experience, really the context in which this drinking might be happening, and also focusing on addressing the reasons women might be drinking while pregnant. It's not necessarily just a lack of knowledge, although a lack of knowledge and the mixed messaging is certainly part of it in some cases. But as we're going to cover in a moment, there are a number of other contributing factors to alcohol consumption. That could be a lack of support, and these are the typical risk factors for high alcohol consumption. Poverty, unemployment, she might be experiencing alcohol dependency, domestic violence, isolation, stress, all of these things could be contributing to someone continuing to drink through their pregnancy. And then, of course, we cover off in our fantastic SMART objectives that, when you're planning and you're setting your objectives as to how you're going to evaluate your program at the end, it's always that specific, measurable, achievable, realistic, and time-bound, which are fantastic. We all use them at work here. And then we go into working with community partners. Now, obviously, that's going to be community specific to your LDAT, to your specific area, to the gaps that maybe you're seeing in delivery. And, it could include family planning, GPs, community health centers. It depends on where you're going to focus, because if you were, for example, engaging with Women Want to Know, obviously you would be then engaging with healthcare practitioners, whereas Pregnant Pause is much more geared towards a whole of community approach. So it starts to get quite specific as to your community partners. Oh, I can say a word about case studies and how we are looking to write a number of case studies on our LDAT's work in the communities. So if you're looking at taking this up as a topic, please talk to your relationship manager, and if you're willing to put your hand up, we want to develop some really in-depth sort of start to finish case studies of the LDAT's work. So that would be fantastic if that's something you'd be willing to do. Okay, we're good? Mm-hmm. All right, I shall continue with the resources that might be required. So again, this is going to be very specific to the gaps that you're trying to fill in your community. But you might be looking to provide some of the resources for community organizations or link them up with other partners. Certainly partnering with the existing programs like Pregnant Pause or Women Want to Know, and facilitating those partnerships in your community. So in terms of delivery, which I'm going to continue jumping into, starting with engaging the community, you really need to find a champion who might be a person or a few people or an organization who is also quite passionate about this, but always keeping in mind how sensitive and how complicated this is as a topic. Again, coming back to that stigma, coming back to that women aren't drinking in their pregnancy to intentionally hurt their child. We really need to work at breaking down that conflicting advice and getting very clearly the message across that the safest option is not to drink. And again, the programs that we discussed, linking community organizations to those quality programs and engaging with the pre-existing programs also helps reduce the chance that anyone might inadvertently wind up doing something that's stigmatizing or alienating, because those programs that exist there are quite excellent. And supporting with communication. So focusing on positives, less about the negative outcomes, especially people who are already living with FASD, and more focusing on how this is going to improve health outcomes for children, it's going to improve outcomes for families. So really keeping the positive instead of the deficit language. That would certainly be a great space for LDATs to help communities in. And ensuring, again, that it's inclusive, that it's that whole of community approach, that it's not just aimed at women, and that, again, it's not the finger pointing, blaming, stigmatizing kind of attitude. And promoting collaboration. Strong referral networks that are supportive and inclusive. I mean, we know that women who are struggling with alcohol dependency are very unlikely to engage in treatment, especially during their pregnancy, because of that stigma and the shame and the self-blame that would be associated with struggling with a dependency while you're pregnant. So making sure that we do have those strong referral networks to help assist women, especially women who might be experiencing dependency. And coming back really to that cultural shift, the understanding of harms, yes, but also the causes. Why are some women still drinking during pregnancy, and what can we do to address the cause? And then the measuring success. Again, this gets quite specific into your program, but if you're struggling, or even if you're just interested in talking a little bit about evaluation, talk to your relationship managers, because our research team is fantastic and they're absolutely here to help out with evaluation methodologies and coming up with helping you develop your evaluation plan. So really, please get in touch with your relationship managers, who can get in touch with our team, and we can help you work on all of these, the different ways that we measure success and the tools that you might use to do that. In terms of resources, there's a fantastic language guide that's called Promoting Dignity for Those Impacted by FASD. There's a link to it in the toolkit, and it's really great in terms of going through language that's very stigmatizing, and then also language that we could be using instead, and some language that we should just stop using, full stop. I would highly recommend that if this is a space that you're interested in working in, as well as checking at the FASD Hub, because there's so much that's available for you to use. And again, case studies, we really want to write them. So if you are looking at working in this space and you would be willing to work with us, please, again, talk to your relationship manager, and you could be one of our fantastic upcoming case studies.
So if I was an LDAT that wasn't working specifically in this space, but I was interested in starting a project, what would be my starting point?
Specifically to address alcohol and pregnancy?
Yeah.
I would look at some of the resources that are out there, and I would want to get a sense of where am I seeing a gap maybe in that would be what I would start with. What is the gap in my community? Is it low levels of the risks of drinking alcohol during pregnancy? Is it that women aren't being told? Is it that GPs aren't asking them, or they're not providing information around alcohol? And I would go from there and say, okay, so is this more taking a whole of community approach and maybe engaging with Pregnant Pause and running an event, or are we going to focus on healthcare practitioners and get involved in that space? Although I also think that, especially if you're dipping a toe in the water, so to speak, it could be really interesting to bring together a number of different organizations and have an event on No Faz Day. So, have the breakfast, have a keynote speaker, and just bring the community together to get a conversation started, really, about, other organizations' opinions too, about how much of an issue might this be in your community and why is it an issue in your community.
And to your knowledge, do you know of a part of Australia or an organisation that is experienced with projects or diagnosis even of FASD?
I know that there are some specific medical organizations that are focused on patient advocacy and on diagnosis. We don't get into them in the toolkit because it's more the medical side of things. But if I were interested as a community in who is working locally in my area, I would get in touch with No FASD Australia.
Great.
Because they are, essentially the peak body, and
Yeah.
they'd be able to link you in with anybody else who's local.
Great. Well, we don't have any other questions or comments from the wider audience.
Well, if anybody thinks of anything after the fact, please send it in, and either myself or my colleagues will do our best to answer any other questions you have, or to send you on any resources additionally that you might be after. So
again, apologies. We had a couple of we had a link in the Eventbrite registration page that was actually wrong. So we apologise for that glitch. But we did. I'm hoping that everybody who is listening in, or people managed to get to the right place via the confirmation email. So. Yeah, apologies for that, but if you did miss the first part of this presentation, it will be up on our website within a couple of days, so you will be able to view it at a later date.
Great. Well, thanks very much for joining us.
Thank you.
Bye.
Bye.